Hello everyone. So many of you were asking about the important topics from anatomy, physiology, and biochemistry. So here is a video. So we will be covering all the important topics for the university exam. This video is for specifically for the university exams. All those questions which are asked and important topics that can come in the paper. So all the questions which can come in the paper from the upper limb is discussed here. In this video, we are doing we will be discussing the long questions, the questions which can come as long questions and the short questions. Most of the time long questions doesn't come from upper limb, either they come from head and neck or thorax, but sometimes it depends upon the teacher. There may be a question from upper limb, so there may be a question, so you don't have to avoid it. Like at the time of my university exam, I got a question on mammary gland, a very long question of 20 marks came from the memory gland, and in that we have to discuss every single thing, specifically headings which you have to cover, and the whole memory gland has to be described in that. So there may be a time that you get a long question from there, so you don't have to ignore it and you have to study. So all the questions that are important in the upper limb we'll be discussing here. So from the long questions one, the most important is the mammary gland, the anatomy of the mammary gland, also known as breast. Okay, so you have to discuss the morphology of mammary gland, relations, blood supply, it's important, blood supply to the mammary gland, nerve supply also. Lymphatic drainage is very important. The most important in the mammary gland is lymphatic drainage. If you don't get a long questions from this topic, then you can get a 5 marks question specifically on the lymphatic drainage of breast. So either way, this is very important topic. You can get a question on development in the headings of mammary gland. You can get a question of development of the mammary gland and applied is very important. In every question you have to write applied, even it's asked or not asked. So you have to mention applied because according to the new curriculum, applied clinical anatomy and applied is very important. Some of your answers through the applied, you have to study the memory gland. It's very important. And do check your previous year's question papers, especially the one before your year, and supply papers also, because if there is a question in supply papers, there is a chance that alternate question around that will come in the paper. Okay, so you just check the question paper from the recent times. Now the next question in the long note, this is brachial plexus. Brachial plexus is very important. The whole diagram of brachial plexus, all the branches, all the cords, medial cord, posterior cord, how the nerves are coming from that, all that is very important. A long question can come from brachial plexus, so it's a very important topic for the long question also. So you can get a question on breast, or you can either get a question of brachial plexus also. In this you have to make a diagram, you have to describe it very properly, all the branches from the root, trunk to the divisions and the branches. You have to cover every single thing in the brachial plexus. Also the applied Erb's paralysis, 2 marks question also you can get on Erb's paralysis in the very short questions. So that can be a question also, Erb's paralysis. In the applied portion also, brachial plexus, you have to write about the applied of brachial plexus also. Now there is a question about nerves. There may be sometimes the examiner think that the nerves are important, and they may ask the question on nerves. The most important ones are the radial nerve or the median nerve. Either way, both of the nerves are very important, and if you are studying anatomy, you should know a little bit of nerves also. Okay, so it's a very major part, that where it is coming from, where it is dividing into, where what are their branches is, and applied also. So you had to have the information on nerve. So this can also be a part of a long question. In this you have to write courses, branches, and applied. Wrist drop, you can get a 5 marks or 2 mark question also separately on the wrist drop. Okay, it's very important in the radial nerve. So this was the third long question. Now comes the shoulder joint. It's rare, but a shoulder joint question can come, so you have to prepare. Okay, the anatomy, type, articular surfaces, ligaments. Ligaments are very important. A 2 mark question to enumerate the ligaments can be the question. Okay, then movement you have to write down, then relations you have to write down, and applied is important in every single question. If you are getting a long question, applied is necessity. Okay, sum up your answer by writing the applied part. Okay, now these 4 questions were the questions that can come in the upper limb from the long question part. Now we are coming on the short questions. There are few short questions like the axillary artery, specifically the third part of the axillary artery. So this is a good question. Then the boundaries and content of axilla, this can also be asked. Then deltoid muscles, the origin, insertion, nerve supply and action of deltoid should be known to you, and the structures under the cover of deltoid, all the structures that are below the deltoid, you should know this. This is an important question. And the applied, that is winging of scapula, you can get a 2-mark question on this also, the winging of scapula. Okay, so this is important. Then there is a short question 5 marks, this can come, that is rotator cuff. Rotator cuff or musculotendinous cuff, all the muscles that are making up the rotator cuff, sit muscles, like now we call it sit muscles, infraspinatus, teres minor, these all. Okay, so they form the rotator cuff and it can also come in the 5 marks question. Then the quadrangular space and triangular space, a 5-mark question can come on this. Cuboidal fossa is important. The courses and the means the cuboidal fossa, the contents of the cuboidal fossa can be asked. It's an important question. Okay, very important question. You should know the contents of cuboidal fossa and all the anatomy of it. Okay, then flexor retinaculum. Flexor retinaculum, a short note can come on flexor retinaculum, so do learn that. Okay, then ulnar nerve, the applied is important. Claw hand is the applied of ulnar nerve, and a short note can come on ulnar nerve. So the nerves are important. The median nerve, radial nerve, and the ulnar nerve, you should know them. Okay, if you are studying anatomy, this is a must question. Okay, you can't ignore the nerves and muscles. Okay, the muscles, nerves, and the blood supply in the anatomy, it's very important. Okay, now the carpal tunnel syndrome, a short note on the carpal tunnel can become, because the applied curriculum, so the question can come on that. Then mid palmar spaces, sometimes due to the muscles involved, and that mid palmar spaces becomes a important and favorite question of the examiners. Then a 2-mark question can be found from tendon passing under external reticulum. 5 marks won't be come from here. Only the 2-mark question can come from the external reticulum, the tendon passing under this. Okay. Then anatomical snuff box, 5-mark question. Yeah, this can come. Okay. Muscles of the thenar eminence, 2-mark question can come from this topic. Pronation and supination, this is important. If you're not getting shoulder joint and they have to give a question from the joints part, then they can give a pronator supination question. And clavipectoral fascia, I got this question in my university exam, so this is also very important. So if we go through once more, so you should know the mammary gland anatomy, it's a must. Brachial plexus, it's a must. Okay, with brachial plexus you should know the median nerve, the radial nerve, and the ulnar nerve. These are the must questions from the upper limb. Other than that, shoulder joint, you can get a question from shoulder joint. Okay, sometimes what happens that either you get a question from shoulder joint, or in the lower limb part you get the hip joint or knee joint. If you are getting those, so you won't be getting a shoulder joint question. So this is how they make up the paper. Now on the short questions, the must, if we see rotator cuff, deltoid muscles is easy. Origin, insertion of supply, I have a separate video of it also, so you can see that. And the axillary artery, third part, it's important question. Cuboidal fossa is very important. Ulnar nerve, I've already told you. Carpal tunnel is important, and anatomical snuff box is important. Clavipectoral fascia is important, and pronation and supination are important. So these will cover all the important topics of upper limb. If you do these, I think you will get 100% marks from the upper limb if you write correctly. The most important part in the university papers are that you write the answers correctly. And if you have any other doubt regarding the video, or any other doubt in the questions, or you want any topic to be explained, you can always comment and can message. Okay, thank you so much.